Feeding cues in newborns can be tricky. Hi, I'm Cindy Rubin. I am a breastfeeding medicine physician and fourth trimester doc in the Chicagoland area. So feeding cues, you've probably heard of most of them. So babies root, they turn towards the breast or the nipple, they put their hands in their mouth or everything in their mouths, lip licking, smacking. Those are common feeding cues. Also just being active, so going from a calm, content, or even sleeping situation to being just more active and moving around can mean that babies are getting hungry. But at the same time, so the sucking, the putting things in their mouths, that one's tricky, as well as rooting. These are all reflexes. So when a baby is touched on the side of their face, they're going to turn towards it. They're going to turn in that direction. And that is called rooting. It is a reflex. It is to make sure that babies do get fed and do eat. But it's going to happen technically, whether they're hungry or not, until that reflex goes away, which doesn't happen until they're a little bit older. And similarly, sucking, not only is it a reflex, but it also is something that babies get quite a bit of comfort from. So this one can be super tricky. Yes, babies suck when they're hungry. Sometimes there are some babies who just love to suck for comfort. And those can be difficult because when they're full, they may continue to suck and want to be on the breast or even suck from a bottle when they're actually full because they just want the comfort and they're willing to put up with maybe eating more than they want to eat or need to eat just to get that comfort. So sometimes it takes a little bit of trial and error in getting to know your baby. And a healthy baby who is gaining weight well and you're starting to be able to tell when they're done. If you think your baby is done, but then you remove them from the breast or from the bottle and immediately they start sucking and it seems like the only thing that will comfort them is putting them back on the breast or the bottle. If they start really eating again, maybe they were still hungry and just needed a little break. But if they seem upset by them being on the breast or they stop actually swallowing and actively eating very, very quickly, then in fact, maybe they just wanted the comfort, which they can get sometimes from a pacifier, sometimes just from being held. Sometimes they don't need to be sucking. You can use your finger to have them suck on that. It can be tricky. And sometimes babies do eat more than they need to just for the comfort. And there's nothing wrong with that per se. And especially at the breast, you really can't overfeed. A baby can overfeed themselves at the breast, but nothing bad is going to come of that in the end. Now, on the flip side, you may need a break. You may need to have a little bit of time with your body being your own and detached from your baby. And that's okay. And it's just going to be trial and error what kind of works in those situations. If you're lucky and your baby will take a pacifier, that may do the job, but some babies just won't take the pacifier. Hang in there, you'll figure it out.